Welcome back to Aging and Awesome. According to the CDC, every 11 seconds an older adult is treated in the emergency room for a fall, and every 19 minutes an older adult dies from a fall.
Falls result in more than 2.8 million injuries treated in emergency rooms annually, including over 800,000 hospitalizations and more than 27,000 deaths.
Falling can not only be devastating to your physical well-being, but traumatic to your day-to-day life. Joe and Eden Home Health talk about it. Have a look.
Hi, this is Joe Della Ripa, and I'm here and I'm talking to Melissa, who is a physical therapist.
Well, thanks, Joe, for having me here. I really want to talk about fall prevention today, and the big thing is helping people keep their balance.
I hear that all the time from people. The worst thing they fear is falling down.
For sure, and it's huge. If you think about the personal cost of falling, there's a lot of data about like the medical cost. It's millions and millions of dollars that we spend as a country on treating falls. But for people personally, it's a much bigger cost. If you have an injury, you end up hospitalized. Who waters your plants? Who feeds your dog when you're gone, right? It's really basic things, right? And if you need help over a longer period of time, it can be who's going to help you with housekeeping, who's going to help you with your shopping, who's going to help you get around while you're healing. I wanted to talk a little bit about how people keep their balance. A lot of people, like if you watch TV, you'll notice that there are ads for canes and walkers and crutches and all kinds of bells and whistles. They're all new stuff coming out all the time. And one of the biggest tragedies is that people spend a lot of money and resources trying to keep themselves safe with a bunch of these external things, when really doing things personally, like we talked about, staying strong, staying flexible, and actually keeping their balance system healthy is what's going to keep them from falling and keep them active as they get older.
That's very good, and I think that more people will, if they listen to what you're saying, they'll find out that, it isn't that scary. I mean, you can't be afraid to walk. You can't be afraid to get up. You have to move. I mean, That's part of your living. And I see that so much with many, many seniors who they're so inactive. They just stiffen up all the time because they don't move it.
Right.
Move it or lose it.
A couple things as far as when people start having risk factors for falling down, some things that I want to make sure people know. The first thing, if you're feeling dizzy or lightheaded or what's called vertigo, so like a spinning sensation, there are about 1,000 medications that doctors prescribe normally for things that people that are common to people that cause those side effects. And so the first thing to do if a friend is fearful of falling or feels unsteady is to have them talk with their doctor about the medications that they're on and make sure that they're on things that they have to be on. Lots of times as we get older, we actually need different dosages of medications or a medication change. I work with people who have been on one medication for 30 years and then they start having difficulties with it. So definitely have them talk to their doctor first. The other thing that a doctor can do besides that medication assessment is look at special conditions that are common as people get older. So things like high blood pressure, medications that control high blood pressure very commonly can cause these side effects like lightheadedness. And when you're in your 40s or 50s, your balance is good and they don't cause problems, but as you get a little bit older and your balance systems get weaker, then those medications can actually cause you to fall. And so I'm not suggesting that anybody change their medications on their own, but definitely partner with your doctor to get the medications that you need.
And what about their furnishings? What about their surrounding where they live? If they, maybe because you don't move as well, maybe you have too many obstacles.
Right.
And so looking at that and finding a way that's a safety.
Right. One of the things I cue to people is if you notice that you're getting around the house by reaching to all of your furniture, then that's a cue that you have a balance problem, okay? And so that's a sign that you need to get some help. So we don't want people using their sofa as a walker.
So
right?
Does that make sense? Maybe you do need a cane,
exactly.
a walking stick.
Exactly. And again, kind of the gateway is your doctor. they can have you work with a physical therapist or another balance specialist who can help you make sure you have the right tool and that it fits you correctly. That's the biggest issue. A lot of people don't realize I walk into people's homes and their walkers are kind of up around their shoulders. They're holding on really high. And so they were just never adjusted properly. Maybe it was from a family member. Maybe it was loaned to them by a friend. And so it's actually getting in their way instead of helping them.
As you say, it's easier to think about getting a cane or getting a walker or whatever, instead of thinking about what can I do, how can I make it better for me, and
Exactly.
what can I do?
Exactly. And you totally hit on a great point that it's easier, or it feels like it's easier to like buy a cane. But the reality is once someone starts relying on a cane or a walker, they lose that ability to walk on their own. They start becoming dependent. Their balance actually gets worse. And so I'm definitely not suggesting that there isn't a place for those tools, but oftentimes working on getting stronger or getting their sensory system and their balance systems working better is really a better choice.
And my whole thing is I just tell people move. That's your most important thing you can do. This is your body. You're in charge of it. Use it. Get up and move.
Absolutely. I wish more people would do what you say.
Next week on Aging and Awesome, we continue this conversation with how to self-evaluate your risk for a fall and what to do to increase your physical strength to prevent one.
Closed captioning for Aging and Awesome is brought to you by Eden Home Health, Northern Nevada's highest rated home health for quality of patient care. Patients have a choice. Ask your doctor for the best in-home health care. Eden Home Health.